we see with untreated hearing loss, we see up to a 40% reduction in the parts of the brain associated with speech, hearing, language and memory. The links between untreated hearing loss and memory are quite concerning, and they're one of the, I guess, key aspects when we're considering, well, how can a hearing loss have anything to do with dementia or cognitive decline, right? We know that the more effort it takes to put conversation together, the less of that conversation is going to be remembered. I had the pleasure of meeting Professor Frank Lynn, who's the head researcher in that study I've been talking about. He was over in Sydney a bit over a year ago, and he was over in a public health capacity. Well, two things. He was over in a public health capacity trying to bring hearing more into the forefront when considering classification for cognitive decline, dementia, even Alzheimer's, which is the most common form of dementia. It's very common, frighteningly common, for people to be misdiagnosed as having cognitive decline, dementia, even Alzheimer's, and they've never even had a hearing test, right? Many of the signs and symptoms are similar, right? And we're going to talk a bit more about those later. And I had the pleasure of being involved in some intensive training with Professor Lin when he was over, and he is currently working on, so we know what the effects of untreated hearing loss are. He's currently working on a major study looking at the effects of treatment, so what happens when we actually treat hearing loss and when we treat it correctly. Those findings are not due to be published until next year. However, there has been quite a lot of other research done in this area looking at what happens specifically in the brain when we have hearing loss and we treat it correctly. The Lancet Journal, which is arguably the most respected medical journal on the planet, particularly in relation to the neurosciences, they did a major report on the best research that is available on dementia prevention. And essentially they came to the conclusion that 35% of cases of dementia could be prevented through lifestyle modification. An important point to make here is that really the pharmaceutical industry have not been very successful in developing treatments for dementia or let alone dementia prevention. So what are the things that we can do to prevent dementia and at which stages of life? Well, they found the conclusion of this study was that treating hearing loss is hands down the best thing that you can do. They've defined it as the #1 modifiable risk factor for the prevention of dementia. So why is hearing loss most important? And I should mention that of that 35% preventable factors, 9% was down to hearing loss. So it's nearly a third of the effect size of the things that you can do to prevent dementia, according to the best research available on the topic. Treating hearing loss was considered to be the #1 intervention. Why such a big effect size for hearing loss? Well, hearing loss is really common. It's the most common cause of hearing loss is aging, and age-related hearing loss will happen to everyone as long as they live long enough. And hearing loss is highly treatable, and the treatments are really effective, particularly when those hearing devices are actually worn on a full-time basis, and the science is just backing that up overwhelmingly. That study was published by the Lancet Journal in 2017, and they also listed that depression, social isolation and physical inactivity were preventable factors separate to hearing loss. Yet we know that social isolation, highly correlated with untreated hearing loss, as is depression, as is physical inactivity. So most of what was addressed in this important research article, combining the best research on dementia prevention, has some relation to our ability to hear well. Right? That 2017 paper was backed up again by the Lancet Journal with a 2020 update, which just came out about 6 months ago in August 2020. And they included some new research in that particular update paper, reinforcing our understanding of untreated hearing loss and cognitive decline. There were 3 studies that looked at a similar topic area, all of which had several thousand people in. So we're talking huge studies. One had like 7,000 people, another 4,000 people, another about 2,000 in different countries. So 2 in the United States, 1 in the UK. And all 3 of these studies showed a significant correlation between hearing loss and cognitive decline, except for those that wore hearing devices. In all 3 studies, what was demonstrated was a protective benefit, at a minimum, of wearing hearing devices against cognitive decline. So we're just seeing that the evidence is just stacking up. These images here, it's looking at the effects of treating hearing loss over a 12-month period. And there were 14 people involved in this study. And again, they used functional MRI to look at the parts of the brain that are lit up when relative to different conditions. So what's happening in the brain before we treat hearing loss, what happens in the brain after we treat hearing loss. And these people actually wore their devices, right? So condition was they actually kept them in. So pre-hearing device fitting, so this image closest to me, so this is the average of 14 people's brains before they had their hearing loss treated. And these people got their hearing loss treated relatively early, right? So we know when we catch it early and treat it early, we get our best results. So what you can see here, the most different aspect of this image relative to the post-hearing device condition is you can see this frontal part of the brain here. This part of the frontal cortex is lit up prior to hearing device fitting. And what's going on there is that particular part of the brain, a part of its job is to integrate different bits of information from different parts of the brain. So we know that most people with hearing loss, and certainly most people that I see in my practice, they've lost part of their hearing to the point where they're missing parts of words. Typically they're hearing the low pitch parts, the vowels. Most commonly, like over 90% of the time, they're missing the consonants, right? So when you're not getting all of the word through your hearing system, in order to follow conversation, we need to rely on our vision to assess body language, facial expressions, movement on lips, in order to put those pieces together, right? Quite often that's not enough, and we need to use our memory and think about the context of the conversation to be able to put those bits and pieces together. Problem is, it's actually quite hard work, and we're not particularly good at it. There's been studies that have looked at the anatomy of our hearing system from remains from around 10,000 years ago, and there really hasn't been much change in the physical structure of our inner ear and these pathways. And if you think about what life might have been like around 10,000 years ago, well, first of all, people didn't live as long as they do now. The average age was people lived to around about 30 or early 30s. So age-related hearing loss, which typically kicks in after our 50s, wasn't really a thing back then. It was also a much quieter time. We didn't have amplified music, industrial noise. In fact, the loudest sound might have been a thunderclap or two. Nothing like the ongoing onslaught of noise that we see here today. It was only 200 years ago that a formal medical classification for the fact that people start to lose their hearing in the high pitches was even given a name. We call it presbycusis. So it's very much a modern day condition. So putting those pieces together is really quite hard work. Most people describe it as being exhausting, right? Because it is really quite hard work. You're having to keep your eyes on who's speaking, and putting those pieces together, it is quite taxing. And we can actually measure these effects in the brain, right? How much additional activity is required when we're needing to put in all this effort. So this part of the brain starts to light up. When we treat hearing loss, so what this study showed was that after having their hearing loss treated, they were able to see both functional and structural improvements in the brain. So you can see these parts of the brain here, they're lit up more in this condition in yellow and orange, and what that's showing is quite a significant change from one condition to the other. So those parts became functionally better. Those people they're able to hear better, particularly in difficult situations, background noise and so on, and verified through various tests. And also what the MRI imaging showed was that those parts that had shrunken somewhat because of understimulation actually significantly grew back. So these parts of the brain are not unlike what happens to, just say, if you've had an arm in plaster for say 6 weeks or so, you know that when that plaster comes off, that we're going to have less condition in that arm because that muscle hasn't had stimulation, right? We see a similar pattern in the brain where we see shrinkage in parts that aren't being stimulated, because the most common forms of hearing loss provide a barrier or a hurdle for that stimulation to get through to these important parts of the brain. Our brains represent, on average, around 2% of our body mass, but consume around 25% of our calories, and is very efficient at repurposing resources to other parts that are in fact being used. So when we go for a number of years with an understimulation in these areas, we see shrinkage, and there's a point where we start to see a permanent pruning away of these connections between our ears and our brains. It takes around 10 to 12 years for that to start to occur. So this notion of putting off doing something about a hearing problem for 10 years, it's kind of it's pretty concerning. So why I like to focus on the brain is because we have the possibility to influence it in favourable ways. Another study that is very recently published showed that within 6 months of having a mild hearing loss, we can see via this MRI imaging what we call a cross-modal reorganization occurring in the brain. Because we become far more dependent on our visual system, the visual system starts to overtake some of the hearing centers in the brain, and in an effort to make us better at lip reading, right? But what happens when that occurs is it becomes increasingly difficult to hear in background noise and groups, and also there's significant cognitive deficits. So when I talk about cognitive deficits, the kind of things that I'm talking about are short-term memory, processing speed, reaction time, general executive function, so the kind of abilities to help us function normally in day-to-day life, all become impaired when our brain reorganizes in that way. and that can happen within 6 months of having a mild hearing loss. The good news is that that pattern can be reversed. That same study showed that when these people were actually treated their hearing loss, actually wore their hearing devices, and they had pretty good quality ones in this study, they were able to, what the researchers were able to demonstrate through MRI imaging and various functional tests is that there was a reversal of that reorganisation effect, right? So the hearing centres went back to doing their job more directly, and hearing and background noise improved, and there were significant cognitive improvements. So short-term memory improved, processing speed improved. These people, their lives got better, right?
If you're interested in learning more about hearing and brain health, Andrew has written a comprehensive book on the subject. You can download the first chapter immediately by clicking the free chapter link below. You'll have the option to order your own complimentary hard copy as well. We only ask that you cover the cost of shipping. If you're interested in a quick assessment of your hearing ability, we've developed an online test that you can access by clicking the online test link below. Indeed, if you'd like to make a booking for a consultation with one of our qualified audiologists, please click the Make an Appointment link below and you can choose your time and location. One of our customer service representatives will also endeavour to get back to you shortly.